Hello, everyone, and welcome to the podcast. My name is Awesome Wantana, and you are listening to the Awesome Wantana Show. Today, we are going to be talking about COVID. They have a new variant, and it is called BA.5. And the topic for today's video, or the title for today's video, is When Will COVID End? This article is called Hopes of COVID-19 Reprieve Fade as BA.5 Subvariant Takes Over by John Kamp and Jared S. Hopkins. So we had COVID, which is like the main one, Delta, Omicron, and the BA.5, which is like a subvariant of Omicron. I feel like when I was reading the article, the New York is pressuring citizens to put on their masks again, and some people aren't listening, which I suggest that if there's a new variant and there's like a lot of cases going on in that area, you should put on your mask. But if there's very limited cases, I don't think you should put on your mask. So this article is by John Kamp and Jared S. Hopkins. It says, COVID-19 is circulating widely as the BA.5 Omicron subvariant elevates the risk of reinfections and dominates case counts, spoiling chances for a summer reprieve from the pandemic across much of the U.S. COVID-19 levels are high in a fifth of the U.S. counties, according to the Centers for Disease Control and Prevention's metric based on case and hospital data, a share that has been mostly rising since mid-April. BA.5 is estimated to represent more than half of recent U.S. cases, averaging more than 100,000 a day, CDC data show, which is a lot, actually. 100,000 cases a day, more than half of recent U.S. cases that's happened before. So BA.5 is probably going to be the variant that has the most cases so far, as I'm reading the article to you guys right now. The true number of infections may be roughly 6 times as high, some virus experts said, in part because so many people are using at-home tests state health departments largely don't track. We think we're in a very high level of community transmission, second only to the Omicron peak from the wintertime, said Jeffrey Duchin, health officer from the Public Health Agency covering Seattle and King County Wash. So this article was actually published today, and right now, as you see, everyone has no school. It's summer break, and I think that this is the variant that has hit the most ever since the wintertime, because it says second only to the Omicron peak from the wintertime. So yes, it is one of them that hits the most. The first one was Omicron hitting during the wintertime, and secondly, it was this one, BA.5, that hit during the summertime. Nationally, wastewater data tracking the prevalence of the COVID-19 virus through July 6 has recently trended up, according to BioAnalytics. Such data can provide clues about the pandemic's trajectory. So we have some data and like a chart that shows us a lot of the pandemic's trajectory, where it's going, and sometimes it can be very predictable, sometimes it can't be predictable, but mostly, because of the sneezing and the coughing and stuff, it spreads really easily around other people. New York City last week urged people to resume masking in public. As I said earlier, yes, New York has been urging people to wear masks again. Indoor settings and around crowds outside. Los Angeles County's public health department said rising COVID-19 hospital admissions mean the county also could soon reach high community prevalence, and that officials reinstate a mask mandate if the county stay at that level for 2 weeks. So New York, yes, they are pressuring, and they're not pressuring, but they are suggesting, and they want the New York citizens to wear a mask, and they're going to shift back to the mask mandate as we were before. Not quarantine, because I'm glad the quarantine is over, but they're switching back to mask mandate for about 2 weeks. Maybe they might do it in some other parts in the U.S., but because right now, in the article, it's specifically towards New York so far. Signs of acute illness remain muted, continuing a hallmark of the spring surge as treatments plus immunity from vaccines and previous infections reduce risk for many people. But the high prevalence of infection in many areas continues to cause disruptions, including canceled flights and spoiled travel plans, sick children silent from a camp and childcare, and hospital employees who can't report to work. It is the same thing to all the variants. This one is also, like the pandemic is affecting everybody. Again, it's the same thing. We got canceled flights, travel plans, spoiled travel plans, children who are sick from camp due to the variant. And so we're trying to find a way to I think we might get, in my opinion, we probably might get some of us to take booster shots who might try and use a different vaccine, but I feel like we're going to stay with the same vaccine and maybe try for teenagers like me, because I'm 15, and we could probably get more booster shots. BA.5's mutations made it particularly adept at causing repeat infections, even in people who had the version of Omicron that caused the large recorded spike in cases last winter. There isn't evidence that it differs from recent strains when it comes to symptoms and severity, virus experts said. There are mixed signals on the subvariants impact overseas, and it isn't clear what path it will take in the U.S. Ashish Jha, the White House's COVID-19 response coordinator, said over the weekend. So, in summary, BA5 has pretty much infected a lot of people, and it has the highest spike in cases ever since the Omicron variant in the winter. This variant has been hitting a lot. It's been about 100,000 cases so far. It's probably rising as we go along. The mask mandates are going to resume starting in New York, and I pray that we don't have virtual school anymore because of the variant, and we keep having new variants as we go on by. So I encourage everyone to stay safe out there. Maybe try and wear a mask, but if not, you don't have to wear a mask, because right now they will announce the restrictions for each and every U.S. state if it comes to every U.S. state being affected by the virus. And so, yeah, I hope that we might get booster shots as well, because there are new variants coming in. And the question for today's video is, will COVID-19 ever end? My name is Awesome Montana. This is the Awesome Montana Show, and thank you so much for listening.